I supervise the Partnership and Workforce Development Unit, and I'm also on the guidance team.
So again, thanks again, Larvita, for joining us. We're doing some outreach regarding obviously the Havens Garden and the COVID preparedness plan that every business has to implement. So to start off, I know I called you up earlier today, and you thought you had your preparedness plan, and I sent you an example of one as well. Can you go over what you have in place right now as far as what type of prevention activities you do in your restaurant as it relates to COVID?
Hold on 1 second, I will grab that.
Okay.
Okay, so I have my injury illness prevention program, and in here it's with the OSHA. It tells me what I have to do. Actively encourage sick employees to stay home, accommodate employees through social distancing or telework if possible, emphasize respiratory etiquette and hand hygiene by all employees. I don't know if you want me to read through all this. Perform routine environmental cleaning, check government websites, CDC, State Department for any travel advisories, plan for infection disease outbreaks in the workplace. Thus, it just says Havens Garden, Southwest School of Dance, and Prestige Gymnastics are following OSHA guidance that says to follow latest CDC guidance. Then it has the OSHA email, prevent and reduce transmission among employees, and it says what it's supposed to do. CDC COVID-19 website, actively encourage risk employees to stay home, considering conducting daily in-person or virtual health checks, general business frequency asked questions. And then again, it's going through safe and healthy workplace, hazards, hierarchy of controls. See the OSHA COVID-19 external icon, guidance for employees, PDF, CDC cleaning and disinfection recommendations, clean dirty surfaces with soap and water before disinfecting them. Then it's most workplaces shall follow the public health recommendations for community-related exposure, instruct potentially exposed employees to stay home for 14 days, telework if possible, and self-monitor for systems. Critical infrastructural icons, wash hands. Then it says Havens Garden, Southwest School of Dance, and Prestige Gymnastics maintains healthy business operations. Identify a workplace coordinator who will be responsible for COVID-19 issues and the impact at the workplace. Implement flexible sick leave and support policies and practices. Ensure that sick leave policies are flexible and consistent with public health guidance, and that employees are aware of and understand these policies. Maintain flexible policies that permit employees to stay home to care for a sick family member or take care of children. The Families First Coronavirus Response Act, FFCRA or Act, requires certain employers to provide their employees with paid sick leave or expanded family medical leave. Employees with fewer than 500 employees, just different things. The U.S. Equal Employment Opportunity Commission, review human resources policies to make sure that your policies and practices are consistent with public health recommendations with existing state and federal workplace laws. For more information, and then it's protect employees at higher risk for severe illness through supportive policies and practices. Older adults and people of any age who have serious underlying medical conditions are at higher risk for severe illness from COVID-19. Support and encourage options to telework if applicable. Consider offering vulnerable workers duties that minimize their contact with customers and other employees, e.g. restocking shelves rather than working as a cashier, if the worker agrees to this. Other flexible options, such, I don't know how much you want me to read, I'm sorry.
No, that's good. Yeah. So that's you're hitting the buzz points that when we have when we talk about COVID preparedness, you're hitting the main points on that.
And then it says communicative supportive workplace policies clearly, frequently, and via multiple methods. Employees may need to communicate with non-English speakers. I don't think we need that part. Assess your essential functions and the reliance that others in the community have on your services or products. Determine how you will operate if absences spikes from increases in sick employees, those who stay home to care for sick families members, and those who must stay home to watch their children until child care programs K through 12 schools resume. Establish policies and practices for social distancing. And it says Havens Gardens help us book dance and prestige gymnastics maintain a healthy work environment. This may include some or all of the following activities: increase ventilation rates, ensure ventilation systems operate properly and provide acceptable indoor air quality for the current occupancy level for each space, increase outdoor air ventilation using caution highly polluted areas with a lower occupancy level in the building. This increases the effective dilution of ventilation per person. Further open minimum outdoor air dampers as high as 100% to reduce or eliminate recirculation in mild weather. This will not affect thermal comfort or humidity. However, this may be difficult to do in cold or hot weather. Improve central air filtration, keep systems running longer hours, 24/7. Ensure the safety of your building, water system, and devices after prolonged shutdown. Follow the CDC guidance for building water systems. We actually have an RO system, so that's which describes 8 steps to take before you reopen your business or building. Give employees, customers, and visitors what they need to clean their hands and cover their coughs and sneezes. Provide tissues and no-touch trash cans. Provide soap and water in the workplace. If soap and water are not readily available, use alcohol-based hand sanitizer that at least 60% alcohol. Ensure that adequate supplies are maintained. Then there's more. Perform routine cleaning. Follow the guidance. And then
I just got to bring Kim just looking at that preparedness plan.
And I've had this. I've had this from the beginning, and we've been following it from the beginning. We have it as soon as people come in. I have the hand sanitizer there if they would like to use it, and I also offer these books for them to look at. I have the Injury Illness Prevention Program, the OSHA regulations, health orders, and then the public notices. And I have one more question before we start talking again. And then not only that, on the back here of it, it's talking about cleaning, what we use to clean, how we clean it, the management and communications, monitor state and local police health communications about COVID-19, cleaning and disinfectant, training. So we've always followed this, and we've always done everything. We've always followed the Constitution, and that's what I would like to talk to you guys about right now, because clearly on February 2020, the Office for Civil Rights, U.S. Department of Health and Human Services Bulletin, HIPAA, Privacy, and Novel Coronavirus. In light of the novel coronavirus outbreak, the Office for Civil Rights at the U.S. Department of Health and Human Services is providing this bulletin to ensure that HIPAA covered entities and their businesses associates are aware of the ways that patient information may be shared under the HIPAA privacy rule in an outbreak of infectious disease or order. What we have to remember in any emergency that does not outdo the Constitution or civil rights or liberties. And Health Insurance Portability and Accountability Act of 1996, HIPAA, the Health Insurance Portability and Accountability Act of 1996, HIPAA, is a federal law that supersedes any state mandates or supersedes anything that MDH would like to say. Patient health information from being disclosed without the patient's consent or knowledge. The U.S. Department of Health and Human Services, HHS, issued the HIPAA privacy rule to implement the requirements of HIPAA. The HIPAA security rule protects a subset of information covered by the privacy rule. HIPAA privacy rules. The privacy rule standards address the use and disclosure of individuals' health information, known as protected health information, by entities subject to the privacy rule. These individuals and organizations are called covered entities. The privacy rule also contains standards for individuals' rights to understand and control how their health and information is used. A major goal of the privacy rule is to ensure that individuals' health and information is properly protected while allowing the flow of health information needed to provide and promote high-quality health care and to protect the public's health and well-being. The privacy rule strikes a balance that permits important uses of information while protecting the privacy of people who seek care and healing. Covered entities. The following types of individuals and organizations are subject to the privacy rule and considered covered entities. I'm not a healthcare provider, health plans. I'm going to the business associations. A person or organization other than a member of a covered entity's workforce using or disclosing individually health information to perform or provide functions, activities, or services for a covered entity. These functions, activities, or services include claims, processing, data analysis, utilization, review, and billing. Permitted uses and disclosures. A covered entity is permitted but not required to use and disclose protected health information without an individual's authorization for the following purposes or situations. Disclosure to the individual. If the information is required for access or accounting or disclosures, the entity must disclose to the individual treatment, payment, and healthcare operations. Opportunity to agree or object to the disclosure of PHI and formal permission may be obtained by asking the individual outright or by circumstances that clearly give the individual the opportunity to agree or ask OS or object. Incident to an otherwise permitted use and disclosure. Public interest and benefit activities. When required by law, side note, actually, this law is a code and codes do not supersede the law or the Constitution. Public health activities. HIPAA security rule. I'm assuming you guys already know the HIPAA security rule, so I'm not going to read that again. But the U.S. Code 241, conspiracy against rights. Not only that, U.S. Code 242, deprivation of rights under color of law. USC Section 1983, civil action for deprivation of rights. I'm assuming you guys know that one also. Also, Civil Rights Act of 1964 is a federal civil rights legislation that prohibits discrimination in numerous settings: employed, education, voting, public accommodations. Section 201A, all persons shall be entitled to the full and equal enjoyment of the goods, services, facilities, and privileges, advantages, and accommodations of any place of public as defined in this section without discrimination or segregation on the ground of race, color, religion, or natural origin. Not only that, I cannot, by law, as we clearly can see, when someone comes into my establishment, tell them, ask them, why do they not wear a face covering? If they would like to wear a face covering, I do not discriminate. They have every right to come in with a face covering, but I cannot go and say, oh, you cannot be here. You have no right to be in here without a face covering. That is not my job. That is, if I would do that, that would be a liability on my business, on myself. Are you guys willing, MDH, you guys personally willing to take liability for anyone that comes in here with the mask on, or if I discriminate against them?
Yeah, that's not.
Yeah, okay. Angie, you got that? Good.
I was just gonna say that that's not what we're here to discuss. It sounds like you're trying to litigate something here, and all we're here today is to talk about, what are the requirements that are under the governor's executive orders, and just making sure that you're clear on what those requirements are. That's really all we were here to talk about. We're not here to argue the Constitution or HIPAA laws, things like that. We're just here to talk about what the state has put into place, through the governor's executive orders.
Okay. Go ahead. I'm understanding that, but I guess I'm following all of the governor's orders. I am following the Constitution. I am following our civil liberties. I am following all of these things. The only thing that you guys are trying to do is force me to be a policeman, to force me to stop people from coming into my business who are not wearing masks, and then you want to fine me on top of that. Not only that, you want to fine me and my workers who have legitimate doctor's notes on not wearing a mask. But even if they don't, again, I can't ask them to wear a...
There is one of the things with the employees with wearing face coverings, there are laws that require you as their employer to make sure that either they're wearing the face covering that's required, or they're given a reasonable accommodation. And so, with that, I know OSHA workplace consultation can help you with that information, but that's why, you would have to either make sure that they're staying 6 feet social distance from everybody during their shift, or they're wearing one of those clear face shields that goes from their forehead down past their chin. Or if they can't accept any of those accommodations, if there's not a job that they can do where they're, staying 6 feet apart from others, then that's, a time when you should consider that they're a risk because they're exposing other employees, they're exposing customers, they're being exposed. And so at that point, it's probably best, to consider that a reasonable accommodation isn't working, and so that they shouldn't be in the workplace. But the best place to talk to about those reasonable accommodation requirements would be that OSHA workplace consultant branch. And I can give you their phone number.
I have I have people who've done it. That's where I got the OSHA
they're
information.
The 651-284-5060. They're the ones that would have specific things. I know MDH has some requirements, or not requirements, some frequently asked questions documents about wearing face coverings, and it does talk about employees when, if an employee has a medical exemption, what should be done, those kind of things. And so I would refer to those kind of things.
So
and as far as the customers, we're just saying with those, all you need to do is post a sign on the entrance indicating that they're required to wear a face covering. That's what the executive order says. Executive Order 2081, it says that you need to post a sign on your entrance. You need to have signage posted reminding employees to wear their face coverings. And that's, you know, for the signage, that's as far as you need to go. They're not asking you to confront the customers at all. But it is to have those reminder signs letting them know that the executive order does require them to wear a face mask, at least while they're not actually consuming food or beverage. And then I don't know if you want Kim to go through some of the requirements in the current executive order, the guidance, as far as what the restaurants are supposed to follow. She can do that.
Okay.
Yeah, so in your plans, does it include the specifics to the current orders with things like spacing and...
They haven't changed, right? It's still 6 feet.
Okay, so that's all in there.
I had my back in March, I moved all my tables, moved everything to be more than 6 feet apart back then. So yeah.
Okay. Do you have any questions or anything that we can clarify further on, you know, what's specific to the restaurant setting for this executive order?
Well, I just, you know, my big thing is I'm in compliance with all of the executive orders. I've been in compliance with them. I have gone above and beyond to follow the Constitution first and foremost, and that's what I do, and that's what we plan on keep doing, is to do what's best for our customers and the people that come in here. So I guess I really just want to, you know, it's hard for me because I know you guys, you know, like you're just trying to do your jobs, right? And you, but I guess right now I'm doing my job, and it's just hard listening to things that goes against the Constitution, and trying to put something on my door that I don't believe in, that is not a law. I mean, the governor right now is trying to make it a law, but it's not a law. A mandate is not a law. It's a suggestion, as he's always clearly said from the beginning. And so as of right now, you know, for I don't even know what I want to say. Just, you're sick, you know, my workers, you know, I don't know. I don't know what else you want me to do, or what you want me to say, I guess, because I don't know. I'm sorry. I'm trying to figure it out. I'm just at a loss of what the governor and what the MDH is trying to do. What is their end goal? What is their end game in all of this? I mean, I can project and foresee what their end goal is. I mean, he comes out clearly and says he wants to, but that's a different story. But it's just really, I guess, where do we go from here? What's the next steps? I mean, Jason has been in there. He sees that my tables are 6 feet apart, and and I always have these on my bar as soon as you walk in, and I have the hand sanitizer there if people want to use it. They don't have to, but if they would like to, you know, and like I said before, if people want to come in with the mask, they're more than welcome to. If they don't want to come in with the mask, they are more than welcome to. I will not turn anyone away. That is not my job. That is not what I believe or follow. So I guess that's really it, if that's any help. I'm not sure.
Yeah, I think, so I just want to make sure that you're aware of all the resources and all the guidance that's out there specific to restaurants and bars, and that's all been addressed in your binders that you've got. So that's all good to go. I guess I don't have anything else to add.
Hey, Loretta, what's your capacity at Havens Garden? Your total capacity, then you'd be at 50% of that?
Right. You know,
I don't know the number?
No, I don't know the number offhand. I'm sorry, Jason.
Okay.
I don't, yeah.
And again, yeah, I mean, we understand with, I mean, you're not alone in a situation where some customers just don't wear masks, and that's been a challenge for everyone from the beginning. And for that part, we, you know, as a focus, I've always been trying to tell the operator, control what you can control, and that's the behavior and the interventions with your employees. And you know, again, yes, we don't expect you to get in an argument with a customer because of mask wearing. Just like Angie said, you provide the opportunity, post the awareness signs, and that's the common message I've been having with my other establishments as well. So in regard to your people that claim a mask exemption, I'm simply we in this case it's for your employees with regarding the reasonable accommodation. I guess that's where we were coming with this. It wasn't about trying to ask them or no. Again, we are not allowed to ask what condition an employee has.
Well, then why am I being punished? Why did I receive a letter stating that because my employees don't wear a mask, I'm going to be fined $10,000?
Angie Kim letter.
Yeah, I mean, I think it's because the only thing I can really think about is, I haven't, read the current letter that you're probably referencing, but if it's for employees not wearing masks, and then a part of that would be reasonable accommodation not being done.
No, we've done reasonable
would think it's for.
Well, we've done reasonable accommodations, and we also have exemptions. So there's nothing that we should be fined for. I shouldn't be receiving threatening letters from you guys.
Who did the letter come from?
Hold on, I'll pull it up.
Yeah, it's probably our standard APO letter that Stephen would have signed.
Oh, okay, so it didn't come from the labor industry or the leads?
No, this would have been through MDH as part of our enforcement process.
Okay.
Yep, Tom. It came from Tom, December 9th. Wilfart? I think that's his, Willifart?
Oh, okay. So, yeah, Wilfart, that it was your, what we can call a 10-day letter, and you had 10 days to respond in writing how you were going to comply with all the requirements. And so, yeah, that's what that letter is.
Yes, I understand that, but I'm clearly stating, I've said it before, even to, that we follow, again, the Constitution first and foremost. We follow everything. I have exemptions for my workers, and but I'm still receiving threatening letters, which is no fun, as anyone should know. I would really appreciate them to stop.
Can you tell me what reasonable accommodations you've made for your workers?
Lots. One, my workers are all related, so they already are immune to everything. Not only that, they are 6 feet apart from everyone else who's back there, and that's all we really need is the 6 feet and the away from everyone else.
And so they're able to remain 6 feet away from all the customers as well?
Yeah, they don't actually interact with the customers, usually,
Okay.
most time. I don't know if you're frozen.
Does the ones that interact with the customers, do they wear masks?
No, I don't. I'm the one who interacts with customers, and no, I do not wear a mask.
And so when you say they're all related, do they all live in the same house?
Yes.
Okay. So, yeah, I mean, I guess, is there any more information that you feel you need from us in order to, have the compliance with the current executive orders? The current one that's related to the restaurant is 2101. I don't know if you've looked at that, and if you've looked at the guidance that goes along with that, and if you've got any questions that we can help with.
What was the biggest things in this one that were different from the last one that you would say?
Yeah, Kim, if you want to go through those.
Yeah, I just pulled it up here, and we can send you links to these after the meeting too, just to make sure that you have the most up-to-date ones.
Okay.
So for this one, the capacity changed.
Yeah,
so
50%.
the capacity number of customers is limited to 50% of the normal occupant capacity, up to a maximum of 150. But then underneath that cap, you still have to allow 6 feet of distancing between your parties. And that capacity of 150 is for both the indoor and the outdoor area. So you could have, if you had a patio or something that's open to the elements, you could have 150 outside and 150 inside.
Okay.
Again, it might be smaller than that depending on how big your facility is.
Right.
No more than 6 people seated together at a time.
Even
if you have
family-
a bar,
Even family
no more.
members?
Even family members.
Why would that be? How does that make any sense?
That is the way that the governor's office and the guidance team wrote this. I guess I can't really get into the why. I can tell you the what right now.
Okay. Sorry.
Kim and I aren't.
I know, you don't get the-
part of. Yeah, we're not part of the why discussion. It's just okay.
Sorry. Okay, I understand that.
Yeah. At a bar, 2 customers can be seated together, so it's different than the 6. Again, they have to be 6 feet apart from one another. You can only be open for service for on-site between 4 a.m. and 10 p.m. And then starting at 10 p.m., you can only do takeout, delivery, and other off-site consumption. Reservations are required. You can take the reservations on site, but it's just in order to make sure that there's control over the seating area and make sure that people are appropriately spaced. And then if you have anything like dartboards or pool tables or anything like that, you need to have some system for making sure that the use of those games is controlled and there aren't, crowds of people waiting to use those games.
So for the reservations, are we supposed to keep track of those, or we can throw them away after the?
There's no requirement for keeping them. There's a lot of operators are keeping them just in case if they did find out that one of their customers was ill, they would have a way to contact other customers and just sort of close that loop. But right now in the executive order and the guidance, that's not actually a requirement.
And what is that? I'm sorry.
It's just to maintain capacity and make sure that there isn't 600 people showing up tonight and there's only room for 100 people or something like that.
And what is actually the number of people that have spread the coronavirus in bars and restaurants?
Oh, I don't have that number in front of me right now, but we could certainly get you the latest data on that if you'd like.
Yes, please. Okay, so basically the same stuff, except for you get 50% now. And
Yeah, I mean, that's the main change.
Okay, thank you.
And then Kim, can you mention anything about music, bands? I don't remember if this is a change or not.
Yeah. Let me scroll down to that page. So you can have musicians, you can have bands. The performers need to be at least in a separate area, or at least not separate area, but they have to be separated from the customers by at least 12 feet. And then the performers themselves need to be at least 6 feet apart from one another. So if you had a band, all the band members would need to be 6 feet from one another. And then karaoke, open mic, other audience participation things are not allowed at this time.
And no dancing, right?
No dancing, yeah. If you have pull tabs or anything like that,
Not right now.
okay, I was gonna say that is allowed. I think that covers that changes.
Okay. Thank you. I'm trying to. Do you guys have any other? I'm trying to figure out if I have any other questions.
Rita, do you have pool or darts?
Not right now.
Okay, yeah, so.
Yeah, and like Kim said, we can, through Jason, we can send you an email with links to the different documents that we think might be useful. Just so with that way, if you want to take a look at it, we can.
Okay. Thank you. I appreciate that.
Yeah, I don't have anything else to add unless somebody else does.
Yeah, and I can, when the guidance documents that we get, I'll send to you, Larvita, and then if you have questions, you can contact me, and we can, go over those things. But yeah, I guess, yeah, this was for information, and so utilize this and implement these things in your facility.
Okay. I have one more question, I guess. So does the MDH take full liability for anything that would happen to any person that comes in that wears a mask? Are you guys responsible for if something happens to them? Or for any worker that wears a mask? Is the MDH responsible liability wise?
Kim and I can't answer that question. We don't know the answer to that. That would be something that, like, you know, your attorney would need to reach out through the Attorney General's office on.
Well, I guess my biggest thing is they want us to enforce things that they don't want to take full responsibility and have liability for. So then we are not only the bad guys on both cases. If something happens to the people that come in, they're going to make us responsible for that. I know, I'm just a rhetorical question. I know you guys don't have.
And yeah, the legal stuff, we're not lawyers. We don't know, you know, all of those things. We're just, you know, here are the requirements that are in place, and
Right.
we're, you know, being required to you know, enforce those.
I have one more thing, I'm sorry. The truth is you guys need to be aware of it, because you guys are the ones who are teaching this. Then that means you would be personally liable instead of the government, and you don't want that liability on you, yourself, or anybody else. It has to go back to the government. These are questions that we all should be asking. And it's not only for me, but it's for you too, that you guys should know when you're doing mandates that are unlawful and unconstitutional, and it affects people's health, then that means the liability would fall on you guys. So it's just a cautionary note that you guys should look into, please.
All right. Well, thanks, Larvita. Yeah. Any other questions, comments from Angie, Kim? Then, yeah. Look for some information from me, Larvita,
Okay.
and review it. And if you have questions, I'll be happy to give you some more information. Okay.
Thank you, Jason. Thank you, guys. I appreciate it. Have a good day.
Yep.
Bye.
Thank you
Thanks,
for your
everyone.
time.
Yep.
Thanks
Bye.
again. We'll see you, Larvita.
Bye, Jason. Thank you.
Yep.
I'm sorry. I was pushing the wrong thing.